So in this session, we'll deal with the histology of liver. It is the largest gland of the body. Weight is approximately 1500 grams. It's a modified exocrine gland. The hepatic artery supplies the oxygenated blood and portal vein supplies the nutrient-rich blood. So it is drained by hepatic veins, which drain the liver into inferior vena cava. Secretions of liver are collected by bile canaliculi and carried out to the extrahepatic biliary apparatus. The liver has following structures like capsule, connective tissue stroma, parenchyma, which is mainly found with the hepatocytes, sinusoids, and other blood vessels. There is perisinusoidal space of Descemet and periportal space of Moll and bile canaliculi. So connective tissue capsule and stroma. So liver is enclosed by a connective tissue capsule called Glissen's capsule. Connective tissue extends into the substance of liver along with the branches of portal veins along with hepatic artery and bile canaliculi. And there are reticular fibers, which are the type 3 collagen fibers, which forms the supporting framework. Hepatocytes, they form the parenchyma. These are the main liver cells. These are large polygonal cells with 20 to 30 microns in size. They have a large nucleus with 2 nucleoli, and there is increased number of mitochondria and rough endoplasmic reticulum because these are metabolically active cells. And you can see the hepatocytes will have 3 surfaces, namely the sinusoidal surface, which also presents microvilli that project into space of Descemet, which faces the sinusoids, then canalicular surface and intercellular surface, where 2 adjacent hepatocytes will have attachment with few junctional complexes. You can see here, this is the sinusoidal surface where you can see the microvilli, which are in relation to the space of Descemet. The space of Descemet is the space between the sinusoid and the hepatic sinusoids and the hepatocytes. This is the space of Descemet. And here you can see these are the sinusoids which are lined by the discontinuous endothelium with the discontinuous basal lamina. Here you can also see the Kupffer cells which are present within the sinusoids, which are acting like macrophages. And in the space of Descemet, you can see here, this is the Ito cell, which is concerned with the storage of vitamin A and lipid metabolism. So these are the hepatocytes. You can see a large nucleus with the 2 nucleoli. You can see the well formed rough endoplasmic reticulum and more number of mitochondria. So which are the indicative that these are very active cells. So liver has dual blood supply, as I said earlier. The portal veins carry 80% of blood and hepatic artery carries 20% of the blood. Portal vein carry the nutrients and toxic materials absorbed in the intestine and blood from the spleen and pancreas. So liver produces bile that is drained by bile canaliculi and through the hepatic ducts and finally enters the extrahepatic biliary apparatus. So portal triad. So in the liver, a branch of hepatic artery, portal vein and bile ductule runs together in the form of portal triads. So around them, there lies the periportal space of Moll. The central vein or hepatic vein do not form a part of the portal triad. The blood from the portal vein and hepatic artery enters into hepatic sinusoids. So hepatic sinusoids drain into central vein, and the central veins drain into sublobular veins, then into hepatic veins, and finally into the inferior vena cava. So there are no valves in hepatic veins. You can see here the portal vein, hepatic artery, liver sinusoids, and from there to the central veins, sublobular vein, hepatic veins, and inferior vena cava. Valves are absent in the hepatic veins. So you can see here, these are the classical liver lobules. These are the central. This is a central vein located at the center of the classical liver lobule. You can see this is hexagonal in shape, and you can see the radiating cords or plates of the hepatocytes. Between them, this space is the sinusoid, hepatic sinusoid. Here you can see the portal triads. You can see there is a portal vein, there is a bile duct, and there is hepatic artery within the portal triad. And the space around this will be the periportal space of Moll. So this is an enlarged view, like you can see the hepatic laminar cords. Between them there are sinusoids, and here you can see the interlobular connective tissue septa. So here you can see this is a portal triad, this is a portal venule and the hepatic arteriole. From both the blood is poured into the hepatic sinusoids, which are carrying the blood towards the central vein. And here you can see these are the hepatocytes. Then from them this thing, like I did not show you this canalicular surface. You can see here. So this is the canalicular surface where you can see there is a bile canaliculus. On either side there are tight junctions to prevent mixing of bile with the blood. So this is the canalicular surface. And this is the sinusoidal surface. The other one will be the intercellular surface where they are attached to the adjacent hepatocytes. So now coming back here. So you can see here from the bile canaliculus, the blood is poured, the bile is poured into the canal of Herring. So from there, the bile will go into the interlobular bile ductule. So canal of Herrings are the intralobular bile ducts, whereas bile interlobular ducts are present along the portal triad. So if you see the classical liver lobule, it is hexagonal mass with central vein and in the center and surrounded by radiating anastomotic plates or cords of hepatocytes. Adjacent plates of hepatocytes are separated by sinusoids as I've shown in the earlier diagram. So in between adjacent classical lobule, a small quantity of connective tissue with portal triads are present. At the angle of hexagon, portal triads run in portal canals, that is the connective tissue area. Space of Mall, it is a space between the connective tissue stroma of portal canals and the outermost hepatocytes. It's called as periportal space of Mall. It is a site for lymph formation in the liver. So portal lobule, it is a triangular area of liver and parenchyma around each portal triad. So it is considered as functional lobule as bile duct lies at the center. Then central veins lie at the corners of the portal lobule. You can see here. In the next diagram, I will show you what is a portal lobule and liver acinas or hepatic acinas or portal acinas or acinas of Rappaport. These are the different names for the portal acinas or the liver acinas. It is a structural functional unit of liver. It has two axes, short axis between two closest portal triads and long axis between two closest central veins. So liver acinas has three zones. Zone 1, it is near portal triads. It receives more oxygenated blood. It is exposed to more toxins. Then zone 2 lies between zone 1 and zone 3. Zone 3, it lies near the central veins. It receives less oxygenated blood, hence more prone for hypoxic injuries. You can see here this is a classical liver lobule which is hexagonal with the central vein at the center and portal triads at the periphery. Here you can see this is the portal lobule with the portal triad at the center and central veins at the periphery. This is triangular in shape. And here you can see elliptical or diamond shaped portal acinus or liver acinus, where you can see this is the long axis between the central veins and this is the short axis between the two portal triads. So here you can see the zone 1 which is on either side or close to the portal triad, and you can see zone 3 which is farther away from the portal triad but closer to the central vein. So oxygenated blood is more present here. So in hypoxia, this is the last zone to be affected and this will be the first zone to be affected. In case of toxins, this will be the first zone to be affected and this will be the last zone to be affected. So if you see the classical lobule, it is hexagon and there is one central vein at the center. Then there are connective tissue and many portal triads, portal canals and space of Mall in the periphery. In portal lobule, it is triangular and at the center there is one portal triad and periphery there are three central veins at the corners of the triangle. And liver acinas is elliptical or diamond shaped. Then you can see there is short axis between the two closest portal triads and long axis between two closest central veins. So liver sinusoids, these are the cords of the hepatocytes are separated by liver or hepatic sinusoids. The lining of the sinusoids is discontinuous endothelium with discontinuous basal lamina, and there are stellate sinusoidal macrophages called Kupffer cells, and there is space of Desse between the hepatocytes and the sinusoids. In hepatic stellate cells are cytosol, storage of vitamin A and lipids, as I've shown in the earlier diagram. So in many liver disorders, cytocells lose their storage function and get converted into myofibroblasts that ultimately results into liver fibrosis. Then intrahepatic biliary tree. Intrahepatic biliary tree drains the exocrine liver, secrete bile and convey it to the extrahepatic biliary tree through right and left hepatic ducts. There is endocrine part of the liver which secretes certain hormones like thrombopoietin, insulin-like growth factor 1 and 2. Then angiotensinogen. So all these are the hormones which are secreted by the endocrine part of the liver. So this is the exocrine part, especially if you see the intrahepatic biliary tree consists of the bile canalicles between the two hepatocytes, then intralobular ductules called canals of Herring, and interlobular ducts, then right and left hepatic ducts. Sometimes there might be ducts of Luschka, otherwise called accessory bile duct. So hepatocytes, hepatocyte secretes bile into the bile canaliculi that pours into the intrahepatic ductules, otherwise called canals of Herring, that will pour into the intralobular bile ducts. Then ultimately right and left hepatic ducts and common hepatic duct. So once this reaches, this becomes the extrahepatic part where this joins with the cystic duct to form the common bile duct. Gallbladder and cystic duct and common hepatic duct, all these constitute the extrahepatic biliary apparatus along with the common bile duct. So you can see here, if you see the outline, the liver is having a connective tissue capsule and the parenchyma, where you can see the classical hepatic lobules are having a central vein at the center, then cords of hepatocytes which radiate, and there are portal triads at the periphery with the portal branch of portal vein, hepatic artery, and bile duct, and liver sinusoids are present. So you can see here, this is the classical liver lobule with the central vein and the portal triads at the periphery. You can see here in the portal triad, you can see the hepatic arteriole, you can see the bile ductule, and you can see the portal venule. So there's a special stain to store the black colored reticular fibers here, type 3 collagen fibers which are forming the framework. So applied aspects are hepatitis. It can be viral, bacterial, or drug-induced hepatitis. So no vaccines are developed for viral hepatitis. Cirrhosis of liver. So chronic alcoholic people will have cirrhosis of liver. Like the initially there will be damage which will result in fatty liver grade 1 to 3 4, followed by cirrhosis. So initially the liver will enlarge. Later on, chronic cirrhotic liver will be shrunken in size because the hepatocytes will be replaced by fibrous tissue, which ultimately results in portal hypertension, where there will be dilatation of portosystemic anastomotic radicals resulting in hemorrhoids, caput medusae, and lower esophageal varices. And Wilson's disease is related to it's an autosomal recessive disorder which is related to copper storage issue. So copper is not eliminated. There will be more storage of copper, and that results in abnormalities. Then hepatic coma and liver failure. So once the liver failure is there, that the waste products from the body will not be converted into removable substances, then the waste products will get accumulated in the body, resulting in hepatic coma. Mhm. Thank you.